ladies, how y'all feeling today? How your pH? Hi, it's your girl Raven with pH Balance Podcast, and today I have the lovely, the beautiful, the smart, the talented, the well-educated Miss Rachel Dennis with us.
She's so sweet.
Rachel, say what's up to the people.
How are you guys doing? And shout out to her for this platform. I appreciate you having me on this platform.
Yes. So Rachel, before we get started, how's your pH today?
It's balanced.
It's balanced?
It's balanced.
Okay, great. So, as you guys know, my podcast is called pH Balance Podcast, and it will only be right if I had someone come on and talk about women's pH and what pH is, because lately I've been seeing a lot of things on social media where men are talking about women's pH and talking about how we smell and all that kind of stuff, and I'm like, oh no, we gotta educate my girls on pH and what pH is and how we can keep it balanced.
Yeah,
so
that's
Rachel,
very interesting.
So Rachel, I would love for you to introduce yourself and let the people know who you are and why you are qualified to educate us today on what pH is.
Absolutely. So I'm Rachel Dennis. I'm a board certified women's health nurse practitioner. I have about 8 to 10 years of experience in women's health. I used to be a labor and delivery nurse, as well as a nurse practitioner in the OBGYN, urgent care, and primary care setting.
Okay, so that's what's up. Okay.
It's balanced, and we're thankful for that. We are.
Okay, well, I want to go ahead and jump on in. So, Rachel, what exactly is pH? Like, what does it stand for?
Yeah, so pH stands for the potential of hydrogen. So you have acid and you have base. And you guys might remember that from middle and high school. You have acid, anything that's less than 7. Anything over 7 is alkalinic. So our vaginas are acidic, like a lemon or a lime, and it usually sits around 3.5 to 4.5, while soap, semen, sweat, blood, those things are alkalinic and sit on the higher side of that.
Okay. So when it comes to a woman's pH, what are the most common ways that our pH is thrown off?
So using soap, and using soap. Intercourse, especially if your partner doesn't have the proper diet, if they drink alcohol, if they smoke. Sweat. So sweat is considered acidic, but it's a much higher acidity. It's like 6.5, almost close to 7, right? And also your menstrual cycle, bleeding.
Okay.
Bleeding can cause that as well.
Okay. So to go back, so you said that our vaginas are acidic and men's penis are basic.
Their semen.
Their semen is basic. Okay, and so because of that, like someone like me, like will somebody try to like really understand that? Like, how could you explain that to someone who's like, I don't really understand what she's talking about?
Yeah. So anytime a man ejaculates, there is a risk to throw your pH off. So we talked about pH is the potential for hydrogen. If your vagina is acidic and you have something alkalinic being ejaculated inside of you, and that alkalinity is increased with smoking, a horrible diet, or drinking, those things can cause your pH to disrupt, which can increase your risk for an imbalanced pH, which is bacterial vaginosis, as most of you guys know.
Okay. All right. So what are ways that we can keep our pH balanced? Like, what can we do to make sure that our pH isn't getting thrown off to where we're smelling weird or funky? Yeah.
So what I usually tell my patients is that to decrease use of soap in that area. And it's really a taboo topic to use soap, because when I ask people why you use soap down there, the answer is either a blank stare, or it's what my mama taught me, or I feel funky. And what I always have to tell patients is you are a rose, mentally, spiritually, all of that. Physically, we are just humans though. Right. And humans do not smell like roses, right? We're not musty or funky or fishy either, but we're not roses. So you don't have to smell like that, meaning you don't have to use soap.
Right.
I also encourage you, like if you exercise, workout, or you just sweat a lot, if your thighs rub together, like most women I know, we have that issue. Keep you some tissue with you so you can pat yourself dry so you're not in that moist environment where fungus likes to grow to increase risk for yeast infections.
Right. So I have a question about that. So you say you don't think that we don't need to use soap at all.
Not there. Now, the fourchette and back, so that area between your vagina and your anus, that area back, you can use all the soap you want. Scrub it dub. But the fourchette and up, your labia majora, which are your lips, your labia minora, which are your skinny lips, your clitoral hood, your clitoris, your urethra, your pee hole, and your vagina, no ma'am.
No soap.
No ma'am.
So what about washing around that area?
So you can, but she's like a vacuum cleaner, right? She gonna all of that. So if you're washing around that area, your vagina has the potential to and still increase your risk to throw it off. I just say don't.
I find that to be super difficult to not wash with soap.
It's taboo. It's super taboo. And it's because our moms taught us, because their moms taught us, or that stigma of you're supposed to smell like a rose.
Right. So what is a woman's natural smell supposed to smell like?
Everyone's different. Okay. Literally. Like everybody's scent is literally different.
Okay, so can you tell us what it's not supposed to smell like?
Correct. So musty. Everybody know what must smell like. I like vegetables cooking. Must, right? And you're not supposed to smell like fish. Like you think about fish sticks coming out the oven or the meat market. Like you're not supposed to smell like that.
Okay, so if you smell must or if you smell fish, then something is off.
Correct.
But it's no exact smell of how a woman's vagina is supposed to smell.
Correct. There. You should kind of just be like odorless. And odors are things that we can pinpoint. You can pinpoint fish. As soon as I said fish sticks, you had that in your nose. As soon as I said must, you had that in your nose.
Right.
You don't have a human scent in your nose because everybody's scent is literally different.
Right. That's
literally.
True. Okay, so I have some questions. So as far as like the foods we eat, what type of foods increase the pH being thrown off balance?
So I ain't gonna say stay away from sugar because it's sugar. But bacteria love sugar. That's what I can say. Fungus loves sugar. They thrive in sugar. And everything literally has sugar in it. Unless you just drink water your entire life. The juices, dairy products, some of the fruits, even natural sugars, but liquor, right. Things like that. I mean, the average American's diet is full of at least 50 to 60 grams of sugar in at least one meal.
Right.
So sugar, it increases bacteria, it increases fungus, which is bacteria vaginosis and yeast. Eating probiotics like the Activia yogurt, taking you a probiotic with more than 50 billion units of lactobacillus in it. You can see that on the back of a bottle, on the hygiene aisle or on the probiotic aisle. Water, flushing your kidneys, flushing yourself out. Those things can kind of help.
Okay. Well, is it true that if we eat pineapples, we smell and taste like them?
I don't know that there's any evidence-based research saying that it does. But from patients and friends, that's what I've been told, honey. Guy friends will tell me that as well. They'll encourage their partner to eat fruit or, pineapples in specific to enjoy themselves. Okay. That's what I've been told. But I don't believe there's any evidence on that.
Ladies, keep eating your pineapples, okay? Well,
I ain't gonna tell you no on that.
Okay, so let me ask you this. So I know that eating yogurt is good for the vagina. Is there
and your gut as well?
Okay, is there a specific type of yogurt?
Yeah, anything with probiotics in it. So Activia is really the main brand. It's green, I believe. Okay. And they have plenty of flavors. I also would encourage Greek yogurt because there's no sugar in it.
Right. It's disgusting, but
it's disgusting.
I have a question. So
might put some honey in it.
Yeah. So let me ask you this. What about inserting actual plain yogurt inside of your vagina? Is that a thing or no?
My Lord.
My Lord. Because someone I know inserts plain yogurt inside of their vagina. Like they'll find a way to get it up there. Yeah. No?
This is my opinion.
Okay.
No books, nothing. My opinion. There is nothing that goes in your vagina besides a penis for the purpose of procreation and or just getting off, right? Or boric acid. And the only reason why I suggest boric acid is because, remember, your vagina is acidic. If you've had an alkalinic property inside of your vagina, increasing your risk for BV, put some acid back in there to reduce your risk. I always encourage boric acid after intercourse, after you get off your menstrual. If you've been in your beach clothes all day, you've been in the pool all day, you ain't changed your clothes after you left the gym, anything to reduce your risk.
Okay. All right.
Yeah.
Okay. Well, that's good to know. But
Boric acid.
ladies, don't put anything in your vagina.
No. A penis or boric acid. Nothing else.
Okay.
No, my Lord, nothing else.
So, I know every woman knows metronidazole.
Yes.
Everyone
yes.
knows.
Y'all can pronounce that word.
We can pronounce metronidazole and diflucan. Okay. It is normal to have your pH thrown off.
Yeah.
Like she said, soap, semen, sweat, all of those things just can throw your pH off, and for me, myself, I'm practicing celibacy.
Yeah.
And I went to the gym and I'm like, why is my pH thrown off? And I'm like, what is going on? And, I was educated by my OB, like, oh, well, you're working out, you're sweating, that can throw you. I'm like, that is crazy, you know?
Can.
But women out here, don't be discouraged when your pH is thrown off because it's a normal thing. It happens, right? We're all imperfect.
It does.
So I have Rachel here to educate us on how we can get it back balanced quick so they won't be talking about us.
For sure.
And Rachel, as far as coming to the OB and getting checked, how often should women come and see you guys for their vaginal health? Say if they aren't having any problems, they just are good. They don't never get thrown off.
Yeah.
Whatever. But they might not be having sex, or they might have a husband they're constantly having sex with. What do you advise for them to come and get checked?
So my advice, and this is ages 18 through death. 18 through death. Under 18 is a little more specific to that lifestyle. But you should be seeing your primary care provider, your general provider once a year minimum. You should be seeing us once a year minimum. Your pap smears do not start before 21 according to the board. So don't go in there asking for no pap at 19. You don't need it until you're 21 years old. You get those until you're 65. And they're every 3 to 5 years, depending on your result. But every single year, you need to be seeing your women's provider.
Right.
Because women don't do their breast exams. Right. You don't know what's going on in the inside, whether you're active or not. And if you are active, you might need to be seeing us a little more often than once a year, maybe every 6 months.
Okay. So what would you advise about shaving, waxing, or is it best to grow hair down there? Because I know a lot of women like it bald. So
men do too.
Yes. Yes, they do. But what is your professional advice on how should we keep our hair groomed down there?
Yeah. So I don't have an opinion on a landing strip versus letting it be free versus balding. What I will say about shaving, waxing, sugaring, or even laser, just be careful. You do increase your risk for infection with using products like Nair. You increase your risk of folliculitis, which is inflammation of the hair follicle, which can be itchy and make you think you got all the STDs in the world when really it was just how you shaved.
Right.
With laser hair removal, you think about skin cancer. So with waxing, you think about, what's the things that can grow your ingrown hair?
Ingrown hair.
Right. Like with all of those things, you're at risk. So in some people's opinion, you leaving it alone might be best.
Right.
You do increase your risk for that smell.
Right.
Not that odor, but that smell. But I think there are risk factors with everything you do. So I don't have an opinion on what you should do. I think you should do a lot of research on each way to get rid of hair and decide if that's ultimately for you. I personally wax and I use a serum that keeps me from having ingrown hairs.
Okay.
Because when I shaved, I was always being seen for folliculitis. And it really can make you feel like you have an STD, because if you're getting your groove on and then you start itching, it's like, well, what's going on? All the time is just how you shaved.
Right. Okay. That's good to know. I love that. So, ladies, our bodies are a temple.
Yes.
It's our duty to take care of ourselves from the inside to the outside.
Absolutely.
So that's why I definitely wanted to have Rachel come on and educate us about pH. But one thing in particular, and I know this is a little off subject, is I want my girls to make sure that you are making sure you take care of your body, because it is precious. You only get one, right?
Only one.
So I'm not here to tell you what to do with yourself, because we all each have a choice and the right to do what we want with our bodies.
Absolutely.
But if you are out here having unprotected sex and with different people, or even one person, even your husband, you want to make sure that you are coming to get checked.
Absolutely.
And make sure you are taking care of yourself, no matter what. And like I said, you have the right to do what you want with your body at the end of the day. But
Absolutely.
I know a lot of people now are not practicing safe sex. Like, they're not using protection, and they're not really scared these days of HIV. They're not scared of anything that they can't, really anything.
No.
So I would encourage you to, deep inside yourself and love yourself a little bit more.
Absolutely.
And understand that I know a lot of girls think sex is sex, but it's really not. It's giving a piece of yourself away to someone each time. When it really is supposed to be for you and that special person, your husband or whatever.
It's precious.
Yeah. So, Rachel, what would you like to say to people who are not practicing safe sex, and what are you seeing more common in your doctor's office these days? Yeah.
So everybody understands that, nobody wants to use condoms, right? It's a sheath, it's a cover, it's protecting you from what you really want to feel. That's cute. That's understandable. However, unless you are monogamous, well, not even just you, if both of y'all are monogamous, this is a different conversation and doesn't pertain to you. But if you're not monogamous with this person, this is your little shawty pimp that you come and see every so often. Your little joint, where been on you from. You need to be, getting tested. And ultimately, you should be wrapping it up. They have female condoms. If he's complaining that he doesn't wear a condom, you wear it. It goes on the inside of your vagina. Plenty of videos on how to insert it.
Right.
But you guys should be getting tested. People confuse STDs. They confuse the viruses, which you will die with, versus the bacterial ones, which you can get rid of with the pills.
Right.
So like gonorrhea and chlamydia, we can fix that with a pill. But if you end up with herpes, you're going to the grave with that.
Right.
If you end up with HIV, you're going to be on PrEP or, any of those other antivirals for the rest of your life. And those antivirals have side effects, y'all. There's kidney damage, there's liver damage. It's not worth a moment of uncovered sheath, uncovered skin. It's not.
A moment of pleasure.
It can be a lifetime of something else.
Right.
And something else I wanted to mention about like doctor's offices. If you've had a horrible or a traumatic experience with a women's health provider in your past, please do not let that deter you from finding someone else. Or if you didn't like what one of your providers said, do not let that deter you from getting a second opinion.
Right.
There are patients that haven't been seen in decades for that reason.
Right.
And decades, cancer is quiet, y'all.
Yeah.
Cancer is really quiet.
Right.
And cancer does not move. Cancer don't hurt. You could be going somewhere for 10 years not knowing that you're carrying something because you don't want to be seen.
Right.
That's something else I wanted to mention. That was something else to get seen, y'all.
Yes.
Please.
So guys, make sure that you are loving yourself. And that's what pH balance is all about, keeping your peace and happiness balanced. And one way to keep our peace and happiness balanced is to make sure we are taking care of ourselves completely, you know, and
inside and out.
Inside and out. And our vaginal health for my women, I want us to make sure that we are looking good and smelling good. Okay, you know, we like to dance and be out and stuff like that. So we can't be dancing and smelling funky.
No. That's not very cutesy.
It's not very cute.
No.
So, and one more thing. So with sex, what do you think about all of these little perfumes and stuff that now that they're saying use on those sprays and stuff that they're saying use down there on our vaginas? I know a lot of people like to use chocolate to get a little spicy in the bedroom.
You have a whole body. You got arms, you got hands, you got a head. Put that stuff other places. You have crevices on inside of your elbows, behind your knees, between your toes and your fingers, and here. The rest of those things get to breathe on the daily. She does not get to breathe.
Right.
Why would you put something there that doesn't get to breathe? It doesn't get any air, doesn't get any sunlight. It's moist. That is a thriving environment for bacteria and fungus.
Right.
Already.
Right. Before
you add stuff. Don't do that. Lubricant, water-based lubricant. That's it.
That's it. Any lubricants you suggest you want to?
So KY jelly. There's another brand. It's called Pink Water, excuse me. And she has vaginal moisturizer and water-based lubricant. Okay. I recommend those to my postmenopausal patients a lot because they deal with vaginal atrophy as a result of your hormones. That's later in life, right? But if anybody's on a certain kind of birth control where vaginal dryness is the side effect, or you just experience vaginal dryness with intercourse, which could be related to a whole bunch of other things, make sure you have some water-based lubricant and don't be embarrassed about it. I've had friends who say they're embarrassed to use lubricant or their partner doesn't want to use. He's not for you, or she's not for you if there's a problem with an aid to help you feel better.
Right.
You know?
So with that, before we go, let me ask you this. A woman being what we call wet, right? I know some women might, when they first meet someone, they're attracted to them. They can get wet just looking at them. It's going good, right? Yeah. And then after years and years of being with that person, and they might have broke your heart a few times. Yeah. We don't get as wet as we may have used to get wet because we're, for one, used to this person. This person done disappointed us a few times, and we just not really, they got to do a little extra to turn us on. Or it might be women who have gotten older and they're going through menopause and they have a husband and they're not able to get is wet or whatever as they used to. It is okay to use lube.
Yes.
What else would you say? Is there anything that women can do who younger women maybe like, I don't get wet, you know?
Yeah, foreplay.
Okay. Increase it.
It's I'm not speaking about the people where it's a quickie, you only got 5 minutes. That's usually not the case, y'all. And y'all know it ain't usually the case. Engage in foreplay.
Right.
And if you notice that you're not getting moist off of foreplay, is it him or her? Is it your partner? Or is it hormonal? Is it something else? And that's where we would come in. Like if you're doing your yearly checkups and you come to us with that complaint, maybe we'll do some lab work to make sure those hormones are normal.
Right.
If they're normal, okay, well, let's go back to our partner. Are we attracted to our partner?
Right.
Is our partner doing something more or less that would, help? Do we need to increase nipple stimulation? Yeah. It's so many different things to explore when it comes to why you aren't moist down there. Right. So many things to explore.
Right. So don't be afraid to speak up to your partner or,
Absolutely.
And you should be able to feel comfortable talking with your partner about those type of issues when it comes to your vaginal health, girl.
Yes,
so
absolutely.
Don't worry about that. And we got to thank Rachel for coming on pH on this podcast to educate us on our pH because we got to keep that pH balanced.
You got to. You got to. There's one less thing to worry about, honey.
Yes. So, Rachel, let the people know how they can find you on social media.
Yes. So my social media is Rachel, Rachel, D as in dog, the WHNP. So Rachel D, the WHNP. On that platform, I discuss a lot of things that happen in my day-to-day life at work. We talk about pelvic pain in specific, endometriosis, adenomyosis, fibroids, which is really big, especially in the African American community. We talk about bacterial vaginosis. We'll have WHNP Wednesdays. I'm going to get into taboo Tuesdays because there's so many things about us that are taboo, like using soap or wearing drawers or just so many things. Or, with men in general, or our partner. Let me say partner. When we engage in fellatio or foreplay before we even get to intercourse, a lot of people's fingers aren't clean.
Right.
A lot of people's mouths aren't clean. You can get BV like that too.
Yeah. So make sure that you're brushing your teeth. Okay.
Yeah.
Clean your mouth.
Fingers, under your fingers.
Wash your nails.
Yeah. Take them, go get a manicure. You want your nails done, go get his done too. And if y'all like that.
Right. And so men, I know we were talking before and you said men don't necessarily like to wipe after they use the restroom.
They don't. They pee, jig, and go. And, some men watching this might say, well, how would she know? Is that not what y'all do? Let's just be, right. I'm not calling you out. I'm just saying how bacteria is increased.
Right.
If you don't wash your hands, if you don't brush your teeth, like when it's 5 o'clock in the morning, you trying to get a quickie before you go to work, brush them teeth real quick.
Right. So I have a question about this. So with brushing your teeth, I know it opens pores inside of the mouth. So what do you recommend on that? I know a long time ago, I can't remember, I think a friend of mine was saying that she maybe a doctor educated her if she saw something that said, wait for sex maybe like a 30 minutes to an hour before you engage in it if you just brush your teeth because it has open pores and stuff in the mouth.
I would agree with that because even on the back of mouthwash or at least the TheraBreath brand, they'll tell you no eating for an hour or 30 minutes. I can't remember. I would encourage that as well. But the thing is, sex is not scheduled.
Right.
Unless, you that alpha female and you schedule your time.
Yeah.
If that's not the case, try your best to at least engage in that hygiene routine beforehand. Like, he getting ready to come over, it's 2 o'clock in the morning and you finna call whomever, have him get himself ready before he get over there.
Right.
And you get yourself ready, which doesn't take much besides a shower and not using soap down there.
Only wash behind the fourchette.
Yes. All you want to do, because that's bacteria back there daily, right? Sometimes more than once a day, depending on who you are. You can have all of that. That's free reign. But this way, leave her alone. She clean herself. I promise you she cleans herself.
And my young girls wipe front to back.
Yes, front to back. Absolutely. And if you're irritated by anything, you could have used the hotel soap or something by accident, blot. Wiping front to back might irritate it a little bit more. I would suggest blotting, making sure that tissue is dry before you pull up your pants.
Okay.
Yeah, that's my suggestion.
Yeah, Rachel, you have really educated us today on how to keep them twats smelling right.
Okay. Twat. It's so many names for her.
I know.
Twat, coochie,
the vagina,
the vajayjay, pocketbook.
The pocketbook.
What else? That thing.
The pat. That's what Mia's grandma told her hers was the pat.
And we ain't even get into what the men be calling it. We ain't gonna go there either. There's so many names for her. My goodness.
Well, we want to keep her balanced.
Yes,
so,
absolutely.
Rachel, we have to thank you so much for coming on and educating us today.
Anytime. Thank you for having me. Thank you for having me.
So, ladies, make sure you like, subscribe, and hit that button down below. And if you have a friend that needs some little help with her pH, be sure to share this video with her.
Absolutely.
And as you know, this podcast is all about keeping your pH balanced.
Yes.
So I hope you enjoyed today's podcast. Thank you for watching. Thank you for listening.
Yes.
And thank you, Rachel, again for coming.
No problem. I hope y'all enjoyed.
Yes. And we're out.
Bye.